What is scarlet fever? It is an acute, febrile, contagious condition characterized by a sudden onset, usually with vomiting and by erythematous skin eruption. It is followed by a characteristic exfoliation of the skin during convalescence period or recovery of the body after illness, rapid pulse, and sore throat. What causes scarlet fever? It is a disease caused by exotoxin released by Streptococcus pyogenes. How is scarlet fever transmitted? It is most contagious in its early stages and in late convalescence period. It is most communicable in these stages if any discharges exist. It is transmitted by very direct contact. It is the very close contact to the person infected, and it may also spread by indirect contact, such as contaminated toys or handkerchiefs. Who is more susceptible? 50% of all cases occurs between the ages of 2 to 10 years, which 6 years is believed to be its highest peak, and occurs only in colder regions rather than in tropical areas. The first is skin rash. It usually begins looking like a bad sunburn with tiny bumps and it may itch. The rash usually appears first on the neck and face, often leaving a clear, unaffected area around the mouth, and it spreads to the chest and back and then to the rest of the body. By the sixth day of the infection, the rash usually fades, but the affected skin may begin to peel. Reddened sore throat. When the fever stops, sore throat passes soon afterward. Bright red tongue with a strawberry appearance. Early in the infection, the tongue may have a whitish or yellowish coating. Next, sudden onset of nausea and vomiting. Then, swollen tonsils in the glands in the neck. It may take a few weeks for tonsils and swollen glands to return to normal. And last, fever with 38.8 degrees to 40 degrees Celsius. The fever typically stops within 3 to 5 days. Diagnosis of scarlet fever. The first is Charlton test. It is an intracutaneous injection of 0.0 cc of scarlet fever antitoxin. Positive if a blanching of the skin at the site of the injection occurs. The reaction will appear in from 8 to 12 hours and usually persists for the duration of the rash. The last one is the Dick test. It is developed in 1924 by Glenda Dick. It is an intracutaneous injection to the skin of the forearm of a scarlatinal toxin produced from Streptococcus pyogenes. In applying the Dick test, it is important to be accurate in exact amount since it may produce a false reaction. The test should be read in 24 hours. If it's positive, an area of redness measuring at least 1 centimeter in diameter will be present. This erythema begins 4 to 6 hours after injection. Complications. The first is otitis media. It is the most common complication of this disease and occurs most frequently in the first week of the infection. Mastocytitis and sinus thrombosis may follow, and Streptococcus is also the responsible organism. Next is acute nephritis. It is one of the most dreaded of all complications of this disease. Its onset is usually indicated by vomiting and rise in temperature. Others are arthritis, adenitis, febrile albuminaria, sinusitis, vaginitis, and etc. The first important point in the care of the scarlet fever patient is to keep him warm, quiet, and comfortable. A daily warm bath not only makes the patient more comfortable but also increases the activity of the skin. Never use alcohol since it is very disagreeable when there is a rash on the skin. A great deal of irritation can be prevented if the bath is followed by a rubbing with olive oil. This keeps the skin less dry and lessens the scaling of the skin. Diet. A soft diet is permitted as soon as the patient is able to tolerate it. At first, the diet should be fluid, consisting of milk, fruit juices, and water. When the throat is very sore, a semi-solid diet may sometimes be permitted. If swallowing continues to be difficult, nasal gauge may have to be used.